Yes, miss.
So any doubt in labor?
No.
So I will download all the notes in LMS by tomorrow, because like we have classes in like we have examination going on in LMS, and I'm not able to open that, and the speed is very less for uploading the videos. We need some speed in LMS. Okay, so that's why I couldn't download. But weekends there is no exam, so tomorrow I'll definitely upload all the notes. Like I think I need to upload antenatal, labor, and postnatal. Okay, so I'll be uploading by today. By if I'll try in the evening, if not tomorrow maximum, I'll upload everything. Okay. So today we will see about the postnatal period. So any doubt in labor? So in women's health, many of the exercises will be keep on repeating. So when you are reading, just have an overall look, so that you don't need to mug up, or you don't need to memorize each and every topic. Okay, so maximum the practicals, especially if you see, there will be very less exercises. Only thing is the way of giving may be differing little bit, but otherwise all the exercises will be same. So in postnatal, I think Dr. Deepthi would have taken little bit about the postnatal. So postnatal period is immediately after the third stage of labor. That means as soon as the umbilical cord and the residuals, everything is coming out in the third stage of labor, the mother is mother, or you can say like the postnatal period will be beginning immediately after all the residuals are coming out. So from that time till 6 to 8 weeks, that particular period is called as postnatal period. So because during this period only, like almost all the physiological changes, whatever happened, will be returning back, or you can say it will be reversing back. Okay. So all the physiological changes, whatever that happened during the antenatal period, will be just resolving back to the original physiological state. Okay, so that period is called as postnatal period. So this period is equally important, because during this period, if you are not doing proper exercises, then the returning back will be taking long time, or the returning back uh, will not be as good as the previous one. That means the mother will not be able to go back to her original state, like before the conception. Is that clear? So that's why our role is very important even in this postnatal period. So during this postnatal period, the mother will be very, uh, you can say like ripen. Ripen means the whole body will be little bit swollen. She will, like when she's looking her at the mirror, she will feel as if she is like a plum, like a ripened fruits. Okay, so because if you see, the whole body will be swollen because of the edema, then like the abdomen will be very loose, flabby, it will be uncontrolled. So you can see whenever she walks, the abdomen will be moving here and there without her control. And like a lot of swelling, bruises, pain in the perineum. Then sometimes she may have incontinence also. Then apart from this, psychologically also they will be little bit down, because they will it is a totally new responsibility and totally new environment for her, and she has to get back to that particular, or she has to get used to those particular period. So that's why it takes a little longer time for her to come back or get back to the original state. Okay, so because of this physiological disturbances, psychologically she will not be able to uh, have a normal routine life. She'll have a lot of insomnia. Because of insomnia and the physiological changes, she will be depressed. That may lead to euphoria or disillusion, all those things. Sometimes this psychological problem will be very severe that
Sorry,
they
Miss.
may end up in they
Miss,
may,
your screen is not. Oh, now okay. Sorry, Miss.
what happened.
Because just now your screen not clear, but now okay. Yeah.
Is it clear? Any glaring is there?
Now okay already.
Okay, so because of the new sudden new change, she will take little time to cope up with the new responsibility. So during this time, we need to give her a good support so that she's able to cope up and uh, come out during this postnatal time. So main problem is, as a PT, we will be looking for the main problem in her body, physically. She will be having uncontrolled abdominal movement because all this 9 months, the mother will be totally, the abdomen will be totally packed because of the uterus coming up in the abdomen. The abdomen organs, everything will be totally packed and they will be completely hold, or like there won't be any space to move at all. But suddenly when the uterus is coming descending down and the baby is out, so the abdomen organs will find lot of space to move. So this leads to uncontrolled abdominal movement. Okay, then edema, bruises will be there all over, like edema will be there all over the body, especially in the upper limb and lower limb. Bruises and pain will be there in the perineum. This is if they have a normal delivery, then definitely they will have these two problems. Then stress incontinence, in case like if the abdominal pelvic floor muscle is weak, then they will have stress incontinence and few of the psychological problems. So as a PT, what we need to do is we need to assess them properly, and we have to give them a good exercises. So before assessing, if you see, there will be a routine postnatal care which will be done by all the team members. So maybe a nurses, midwife, maybe doctors, gynecologists, all those people. Sometimes even surgeons will come and meet her during this postnatal time. So routinely they will be having certain things to be done. So apart from that, as a PT, we first start with the assessment. So assessment is, you will be having subjective and objective, and as like your antenatal time, even postnatal time, you will not be able to do much of the objective assessment, so you will be getting all the details from the medical record. So as usual, subjective assessment will be the demographic data. Then comes the chief complaints. So chief complaints here, this is the common problems which I'm going to say. But apart from that, some women may have some other problems. So you have to just look for all these kind of common problems, plus you ask them whether they have any other problem. But sometimes they may not have this common problems also. So first thing is loose and floppy abdomen, incontinence, pain over the pelvis, back and thorax. Legs and hands will be swelling. There will be soreness in the breast. Sometimes it will be very heavy because they would have started to secrete milk. So that milk secretion will make the breast little heavy. Some people will have cracked nipples. So in the antenatal time itself, we will be checking their nipples and other thing, whether they have any crack, In case if they have crack, then you can ask them to apply lotion and other things to make it little moisturized so that they don't have any problem during the postnatal time. But during the postnatal time, we will not be able to allow them to apply a lot of lotions, because when the baby is drinking milk, they need to be very careful. Otherwise, if they have cracked nipples, they can apply the lotion. So before feeding the baby, they have to go wash their nipples properly. Then they might have this encroachment. Encroachment means the milk will be secreted as and when needed. But sometimes if the baby is not drinking the milk properly, or if the baby is in NICU, then the milk will not be let out. Let out means like the milk will be just remaining in the breast, and that will lead to encroachment. So this encroachment will later lead to infection and other problems. So we have to avoid this breast encroachment. Okay. Then the ducts will be blocked. Their body will be like the breast will be very tender, sometimes hot, and they will be having some lumps. So we need to check the breast properly for all these things. So first soreness will be there, then sometimes they will have heaviness, then heaviness is normal. Okay, soreness is also normal. But all other problems like cracked nipples, encroachment, blocked ducts, all these are abnormal features. If they have, then they may end up in a lot of other problems. So you have to ask about that. If they say they have, then you have to check it. Then other problems are tiredness, depression, loss of libido. So these are other problems due to the increased responsibility. So these are some of the common problems. Other than that, you can next is like, other than that, you can just ask them whether they have any other issues. If they have any other issues, then you have to check that in detail. Then next is history. So as your antenatal, this postnatal also, you have to get the history from the medical record. So you will have present history like onset of the problem, personal history like how is their lifestyle, like how is their personal life, like whether they will drink, smoke, what are the hobbies they have, how is their diet, whether they have normal diet or they have some whether they have normal diet or some people will have some peculiar diet habits. So regarding that, you have to check. Why you want to check is they might have constipation. So if you want to correct their constipation, you have to correct their diet. They have to take a lot of fiber diet. So you have to check for those things. Then medical history, you need to check for any medical problem they have and what are the medications they are taking for it, how long they are having this medical problem. Okay, so next is obstructive history. So in obstructive history, as we know, we have to check for GPAL. So G is number of conception or number of pregnancy, positive pregnancy. Then P is number of delivery. So sometimes the pregnancy may be positive, but later it may get aborted after 2 or 3 months. So your G and P need not to be equal. Okay, so sometimes it will be need not to be equal. Is that clear? So G is number of conception, P is number of delivery, and next is A. A is called as abortion, and L is number of live birth. Sometimes the baby may born, but it may die after 1 or 2 months or 1 or 2 days. Sometimes it may die, sometimes it may be delivered dead. So here again, this P and L need not to be equal. Is that clear? But when you count A and L, then it should be equal to G. So this is about the obstructive history. So after that, you have to check for the parity in detail. So what are the types of delivery they had, whether it is normal, cesarean, or they had an assisted normal delivery. So all those things you have to ask. How long they had the labor. So in the first pregnancy, definitely they will have a longer labor. Then second, third, and all it will be less. Then next is gynecological history. So gynecological history is regarding the menstruation. So what is the whether they have normal cycle or any irregularities is there, any hormonal influence is there, all those things you will get in gynecological history. Surgical history, whether they underwent any surgery related to pregnancy. Then previous management, they might have the medical problem. So for those medical problem, if they are taking any drugs, so that will come under the medical previous medication. Then in antenatal, you will not have this. So in postnatal, you will be having this that is called as fetal history. So you need to check about the fetus also. So in fetal history, you will be checking the sex of the baby, the height, color, weight, the number of times the baby is feeding, whether the baby is sucking properly. So you can check the oral reflex of the baby, whether it is sucking, having the normal suckling reflex, whether it is having a normal neonatal reflexes, all those things you can check. Then you can also check the head circumference. Then how is the baby, whether it is very active, how it is moving the legs, all those things you have to check. Then next is like you have to see whether the baby has any anatomical deformity or congenital deformity. So those things you have to check. So these are the things you will be checking in the fetus. Apart from that, you will be having something called Apgar scale. So Apgar scale is they will be having 5 criteria, and this 5 criteria will be checked during the labor, immediately after the labor. So they will be checking this at the first minute, fifth minute, then seventh minute, then 10th minute and 12th minute of the baby's birth. So immediately after birth of the baby, then at the fifth minute, seventh minute, 10th minute and 15th minute. So based on this only, they will be deciding whether to take the baby to the normal ward or whether to take the baby to neonatal ICU. Is that clear? So based on all these only, they will be deciding whether they will be taking the baby to the normal ward or to cesarean section. Is that clear? So this is called as Apgar scale. So A stands for appearance, P stands for pulse rate, G stands for grimace, or you can also say it as reflex. A stands for activity, R stands for respiratory rate. So in this, if the baby is totally blue, then it is scored as 0. If only the limbs are blue, then it is scored as 1. If like there is no blueness, all are red or pink, then it is scored as 2. So next is pulse rate. So if the pulse rate is absent, then it is 0. If it is less than 100, it is 1. It is more than 100, it is 2. Because in fetus, normally it will be more than 100. Then next is regarding the grimace, or you can say reflex. So immediately after the birth, the baby has to cry. So they will check whether the baby is crying or not. So if no response or no cry, then it is 0. Very weak cry, then it is 1. Good cry or strong cry, then it is 2. The next is activity, how it is moving its body. So immediately from birth, it may not move, but after a few seconds, it will start to moving. So no movement is 0, few movement will be 1, and good movement will be 2. The next is regarding the respiratory rate. The respiratory rate should be in between 30 to 35. So that is the normal respiration for the kids. So you can see whether how much respiration they have. So normally during the first minute, they will be crying and taking the respiration. So when you are seeing at the first minute, you need to see how is their cry, whether the cry is weak or whether the cry is good. So we have to just add up all these things and we can see like how much is the score. So depending on the interpretation, we can take the baby to neonatal ICU or normal ward or to a very intensive care. So first is if the score is above 7, then it is normal. Okay, but if the score is between 4 to 6, then it is fairly normal. So here they will be taking the baby to neonatal ICU and they will be just giving oxygen support. Then if the score is below 3, then the baby is very, very critical. They will put her in ventilator and they have to treat the baby. Okay, is that clear? So this is about the fetal score. Next is your objective examination. So objective examination, we need to check the posture and posture, muscle power. So in muscle power, you need to look for abdominal muscle power, pelvic floor muscle power, and the spinal extensors muscle power. Okay, so posture, I have already in detail, I have explained you in your antenatal class. So I'm not going in detail of that. So you need to assess the posture in straight standing and as well as in the sagittal plane transverse. We have to check the anterior view, posterior view, and the lateral view. All the views we will be checking for the posture. Exactly. So mainly they will be having rounded shoulder and latching back. So you have to check for all these things. Then for the abdominal muscle power, we have to do using MMT. Okay, so I'll show you how to do MMT. So next is like you need to check something called diastasis recti. So in the antenatal period, we have seen something called as linea alba, that is in the middle of the abdomen, the rectus muscle will separate to each other, and because of that you will see a line over the abdomen. So now sometimes the mother might have some splitting of the abdominal muscle. So they might have some splitting. So you have to check what is the severity of the splitting. So according to the severity of splitting, you can decide how you want to give the exercises. Is that clear? So you need to treat them properly, otherwise they will be going into some other problems. Then next is regarding the swelling, whether to check whether it is pitting or non-pitting, whether it is affecting the vascularity. All these things you have to check. Then range of motion. So range of motion you can just check generally. You don't need to go for goniometric checking for each and every. But if you feel there is stoppage of the normal range or the person is not able to do normal range, then you can go for testing. Okay. The next is regarding the stiffness, sensation, all those things you have to check according to the dermatome level. Then so these are the things you will be checking. After doing all these things, we will just prepare a problem list. Then based on the problem list, you will be doing aims and means. That means like you will be doing how to do it and why to do it. So that is your aims and goals. So we will see how to check this muscle power. Then we will see how to check this diastasis recti. Okay.
This is mainly muscle testing for trunk flexion. I'm going to stabilize down here at the feet with my forearm or my hand. Okay, I'll have it the patient put their hand behind their head, and I'm going to ask them to do a sit-up looking for them to be able to clear their scapulas off the table. Patient that can do that right there, go ahead and come on back down. That would be a grade of a 5. If they can't do that, you ask them to cross their arms in front of their chest and repeat the same maneuver. Okay? If they can do that and clear their scapulas off the table, that would be a 4. They don't have to come up that high, just as long as they clear their scapula off the table. And if they can't do that, they put their hands straight out in front of them with their palms down, and you have them come up till they clear their scapulas right to there. That would be considered a 3. If they can't do that, relax. Basically, what you're going to do is just have them try to do a sit-up, and you're going to see if their abdominal muscles are actually contracting. Go ahead. And I can feel their abdominal muscles contracting, so I would say that they're contracting. That's a 2, 1, or a 0. Kind of hard to differentiate what grade that is. Okay? Manual muscle testing for trunk flexion.
So this is for rectus abdominis muscle. So for pregnant mothers, you can do it in crook lying because it will be very difficult for them to do with legs straight. So you can do this testing in crook lying. So I just repeat the video.
This is manual muscle testing for trunk flexion. I'm going to stabilize down here at the feet with my forearm or my hand. Okay, I'll have the patient put their hand behind their head, and I'm going to ask them to do a sit-up looking for them to be able to clear their scapulas off the table. Patient that can do that right there, go ahead and come on back down. That would be a grade of a 5. If they can't do that, you ask them to cross their arms in front of their chest and repeat the same maneuver. Okay? If they can do that and clear their scapulas off the table, that would be a 4. They don't have to come up that high, just as long as they clear their scapula off the table. And if they can't do that, they put their hands straight out in front of them with their palms down, and you have them come up till they clear their scapulas right to there. That would be considered a 3. If they can't do that, relax. Basically, what you're going to do is just have them try to do a sit-up, and you're going to see if their abdominal muscles are actually contracting. Go ahead. And I can feel their abdominal muscles contracting, so I would say that they're contracting. That's a 2, 1, or a 0. Kind of hard to differentiate what grade that is. Okay? Manual muscle test.
So practically, we will be making the person to be in crook lying, and we will start the testing from muscle power 3. We don't start from muscle power 5. Okay, so you have to start from muscle power 3. They're able to do, then you go to 4, or if they are not able to do, you have to go to 2. Okay, so this is for upper abdominal. This is for lateral abdomens. Okay.
The first step will be hands behind the head, and basically what I'm looking for is for her to be able to do a sit-up with a rotation, clearing her scapula off the table. Okay, so go ahead and take your right arm to your left hip and come up off the table. Okay, back down, come on up the other way. Okay, back down. If they can't do that, then they would put their hands in front of them like so, and you would ask them to repeat the same maneuver. Go ahead. I'll do a better job holding you next time. Go the other way. Okay, can clear up. If they can't do that, then they would put their palms down like so. Go ahead and do the same procedure. Okay, cleared. Okay, cleared. Okay, so that would be a 5, 4, and a 3 based on the positioning of their hands. If they can't do a grade 3, you could just ask them to stay in that position, go ahead and come on up off. And basically you're just feeling for if the abdominal muscles are contracting. Okay, relax. And that would be a 2, 1, or 0, depending on what type of contraction you get, or if you don't get a contraction. Manual muscle testing for trunk rotation.
So this also you will be doing in crook lying. And you will start from grade 3. If they're able to do, then you go for grade 4. They're not able to do, then you have to go for grade 2. Okay. Next is for your spinal extensors.
extension. For a grade 4 and 5, I'm going to stabilize down at the feet. I'm going to ask the patient to put their hands behind their head. And then I'm going to ask them to lift their torso up off the table, okay? And a 5 would be that demonstration there. You can go back down, where they can bring it up and hold it and lock it, okay? Go ahead and come on up. If they can't come up and they start to drift a little bit, that would be considered a 4. They can't quite hold it and lock it, okay? If they can't do either one of those, then you would have them put their hands to their side with their palms down, okay? You would stabilize again here at the pelvis or down at the legs, and then you would ask them to repeat the same thing. Just go ahead and come up off the table, and then you can see if they can come on up the table. That would be a 3 with their palm side if they can't do the one behind their head, hands behind their head. If they can't do that, you're going to keep them in this position, and you're going to stabilize either at the feet or at the pelvis, and just ask them to come up off the table. Okay, go ahead, come up, and then you're just really feeling for contraction of the musculature, and that's a 2, 1, or a 0 on the manual muscle testing for trunk extension.
Okay, so this is for your spinal extensors. Next, for the lower abdominals, you can
except add rotation. So this is a 5, 4, 3, partial is a 2, contraction is a 1, nothing is a 0. She still has to clear both scapula in the crunch, but she has to be able to rotate this shoulder over to one side, almost to where the shoulder is at midline. Okay, and both scapula clear. So if a patient does this and they just rotate over, her left scapula is still on the table.
Sorry.
Okay. You okay?
Yeah, just clean your laundry basket beside that.
So the left scapula is still on the table, so she's rotating, but she's not using her obliques because she's not rotating, flexing. So a patient, you know, if you try to have them do this and they go way over, and you go, oh yeah, they can do really good rotation, but they're not coming up to, that's your trunk rotators, right? Remember talking about the whatever group, the multipodi, the rotatories, those are your rotators, different muscle group. We're trying to test obliques. So, come up. Now we know she can't clear her scapula, right? So we're going to say she can't do that. We tried this one. She can't do that. We're going to try this one, okay? Come up. Try to come up. Good. And then rotate over to your left. Okay. Do you guys think she's a 3? It's a good solid? Yeah. That's not too bad. We all are probably a 3. Okay. So that would be your obliques test for right external, left internal. So you're actually testing both sides when you rotate to the left, but one external and one internal. Let's go to your right side. Come up, 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 and nope. Now she substituted. Do you see what happened there? That last part was a substitution of hip flexors. So we want to make sure she rounds, round up, good. That's what we need to see. Cleared, cleared. I'm feeling that she cleared her scapula. I don't eye it, I feel. And make sure that inferior angle is off the table. Okay? That would be her left external, right internal. And so she's a 3. Okay. The lower abdominal test. Now we tested rectus abdominis, internal and external obliques. This test, trunk rotation goniometry, you don't want to get on your competency. This is the muscle test you don't want to get on your competency because this one's very specific. Lower abdominals is your transverse abdominis primarily and your obliques. So they're going to be synergists. They're going to help pull that pelvis back. So the first part of the test is to put your hand, see my hand under here? Okay, I'm going to slide it back. It goes right under like L4, 5S1, right in the small of the back, people call that, or right where the back kind of arches. And first you have to see if she can do a strong posterior pelvic tilt. Remember, the transverse abdominis does posterior pelvic tilting, right? So I want you to try to smash my hand. What's happening? Patients will do this. They will pull their air in. They'll like bear down. It's like a Valsalva. You guys learned about the Valsalva maneuver? Where you kind of push your air in to get compression in the abdomen. Try to like go. It's that maneuver. It's the Valsalva maneuver. Okay. Patients will try to get that pressure by doing it with their lungs. Okay. So you have to make sure they're breathing. Usually you can just like watch their face, breathe. So what I want you to do is just try to tilt your pelvis back from here. Don't do anything with your lungs. Don't try to hold your breath. Don't try to lift your body up. The motion comes from here going backwards. Okay, so you're going to use these muscles right here. Push down on my hand. Push down. Okay, where can I do this? So she is actually kind of on the lower end of the spectrum because this is like a 2 patient just to be able to posterior pelvic tilt without the leg movement, which is the next part of the test. So I need someone stronger so I can show the test. Sorry. You either got lucky or not. I know. Who's got decent abs?
Yeah, Melissa does. She does P90 every morning.
Get up here, girl.
I really don't. Yes, she does.
We're going to find out. Okay. So you're going to lay flat. All right. Now, my hand is under here, okay? So I'm just sliding it under the small of the back. Try to smash my hand. Perfect. She's totally smashing my hand, okay? All right. So that is, let's see here. Pelvic tilt is a 2. If she can pelvic tilt, that's a 2. But the pelvic tilt has to happen in the starting position. So if you've ever done any lower abdominal training, then you know that you involve the legs a lot of times, okay? So what we're going to do is we're going to bring the legs passively up to 90. So notice, just relax. I'm going to explain to her what I'm going to do. So I'm going to bring your legs up, okay, and I want you to just relax. I'm just going to bring them up here. Let me know if you have any pain, okay, and then I'll explain what we're going to do when we get there. I've already taught her or explained to her how to smash my hand, right? Okay, so I'm just going to bring your legs up to 90. Now some patients have tight hamstrings, so they're not going to be able to go that far. You might have to allow them to bend a little, okay? But you want to go as straight as you can to 90 at the hips. All right, now I'll slide my hand under here again. This is the only way that I can monitor pelvic tilting. Okay, here, hold on. I'm going to put my hand over there first. Okay, we're going to bring her up to 90. Now, smash my hand, tighten those same muscles. Perfect. Now, we're just going to lower the legs slowly down, and I want you to keep smashing my hand. Okay? Keep going down. Just let your legs come down. I'm actually lowering them, but she's helping because I'm not doing most of that work. Push down. Push, push, push. Oh, can you push? Smash my hand. Smash. Okay, good. Keep going. Down. Down, down. Smash my hand. Smash. Okay. All right, she's done. Okay. So, here's where she could not smash my hand anymore. This angle is what you need to know to give her a grade. Okay? So, this is 0. What do you think this is? Can you give me a guesstimate? 45? Okay. Now, once I decide that, and if I need to get my goniometer out, I can. You can keep the hips at that angle. Let your knees bend. And just put the feet down and get your goniometer out if you want. Did I change the angle here? No. So I can still do that. And I can do that at any point. Okay, if she went all the way down to here, and I wanted to measure, let your legs relax, and just put her there. You see what I'm saying? But when you get better at this test, you can kind of eye it. So I would say, she was here, and I go, okay, she's like 45 to 60, somewhere in there. Okay, so on your test, if you look at this lovely chart that I've given you, A 5 is if she can go all the way down to just hovering above the table or to 0 without losing that posterior pelvic tilt. So if you've ever done lower ab work, I know we're running over, I'm sorry. Everyone's looking at the clock and then glaring at me. But in like in my yoga classes, we'll do a leg lowering, and the whole point is to keep your pelvis in a posterior tilt, right? Okay. So she was at 45 to 60, so she didn't quite make it to a 5. A 4 plus is 15 to 29. A 4 is 30 to 44, and a 4 minus is 45 to 59. So I'd say she was in that 40 to 59 range, so she's a 4 minus. Taylor was 2 over 5. Okay, got some work to do. We all have work to do, right? Nobody wanted to, I got 5 over 5 X, right? Okay, last.
Okay, so I think like you will be having one.
Last test. I'm sorry, guys. I know you guys want to get out of here. All right. Do you remember the abdominals test? Okay. Now we're doing trunk extension, and it's the same. 5, 4. I think. Wait. Do you remember? Arms behind the back. 4, 3. Okay. So instead of here, it's here. Okay? So your grading is going to be 5, 4, 3. And then 2 is partial clearance, 1 is contraction, 0 is nothing. Yes?
Our paper says arms behind head, waivers is 4.
Okay. Okay, so there's no arms behind the back. Okay. So it goes from here to here. Yeah, for 3. Okay. So, I'm going to see if she can just put your chin down for me and hands behind your head. On this test, it's really important that you stabilize the legs, okay? Because her glutes will kick up and try to help. Okay, so you're going to stabilize anywhere along here, and then just try to lift your body off the table. And she is 5. And how do I know she's a 5? Because her sternum cleared the table. How do I know? Well, I would have palpated that. But on a female, you probably don't want to reach around and feel the sternum. Okay? Sternum is going to be pretty much at about T8, T9. Okay? But you want to kind of look, you know, make an observation. Let's try it again. Put your hands on your head and come up. Okay? And kind of just see where her ribs are. You know, her ribs are going to go ahead and go down. Ribs are going to come up and articulate with the sternum attached to the sternum. They don't really articulate there. Okay, that would have been a 5. So she couldn't do that. So let's try to do a demonstration of a 5 that wavers. Okay, no, you're going to put your hands behind your head, but then come up and just have a hard time. So she's kind of like, oh, I can't really hold it. Okay, that's a 4. Okay, then if she couldn't even lift up in that position to clear the sternum, then you would have the hands down by the side and see if she can come up there. That would be a 3. If she was in this position and she could not clear the sternum, but she could get some movement off the table, try to lift partially, that would be a 2. Okay? No lift, but contraction, you got to palpate, of the extensors, try to lift up. She's not coming up off the table at all, but I feel the muscle contracting. That's a 1. And if she were paralyzed and had no control of these, and I said, can you just try to pick your body up off the table, and nothing happened, that'd be 0. Okay? That's the last test.
Okay, so this is for your MMT checking. Next is like we will be checking how to do for diastasis recti.
is a split between the left and right side of the abdominal wall. This occurs in 100% of women. Diastasis recti is a split between the left and right side of the abdominal wall. This occurs in 100% of women at 35 weeks pregnant. While most of them resolve on their own, some of them do need to be addressed. Diastasis recti is really easy to assess on yourself. I did it on myself after my last child, and I did have a split. I was able to correct it with a few simple exercises. I'll show you how to check your own and a few safe exercises that you can start. Find your belly button, and then you're going to palpate up the midline or the center of your abdominals. Push in gently, and you're going to curl your shoulders up. This will cause a contraction of these abdominals and enable you to feel a split. You're going to palpate up along towards your rib cage and then down below. If you do feel a split, you can turn your fingers horizontally to see how far across it is. 2 centimeters or greater is considered significant and something that you should have checked out. If you do happen to feel a split, you're going to put your fingers on either side of the split. Think of your abdominal muscles pulling apart this way, and your fingers are going to push them back together. So kind of get in there and push them together, and then you're going to do a little abdominal contraction. This will engage those muscles. I also recommend doing a Kegel contraction prior to that. That recruits your pelvic floor muscles as well. So Kegel contraction, push the muscle fibers away, let your knees fall out. Then try to use the same Kegel contraction and core to pull your knees back together. You should feel it working down through here. Another safe exercise to do is, again, approximating the 2 sides of your abdominals, Kegel contraction, tight core, and slowly straighten one leg out. Hold for 5 seconds if you can, and come back in. Do the same thing on the other side. The next exercise that you can do is, again, approximate tight core Kegel contraction, and this time just bringing a knee up and coming back down, and again on the other side. Same count, 10 times, take a break, and then 10 times. If these feel good, you can do the same thing again, same setup, and bridge up off the table and come back down. If you're unsure whether you do have a split, or you're having pain or difficulties with any of these,
This is how we will be checking diastasis recti. Then, according to the size of the diastasis recti, that means according to the separation size, we will be dividing the diastasis recti into mild, moderate, and severe diastasis recti. Okay, so we will continue the PT management in next class because Dr. Deepthi is already waiting for our class, waiting for the class. Is that clear? So if if there is any doubt in the assessment part, you can just WhatsApp me or we can discuss in next class. Is that clear? Thank you all.